Established in 1996, the Institute for Public Health (IPH) conducts research, training and consultation, fulfilling the health services needs of the nation. Since its inception, IPH has conducted several large-scale national-wide surveys, the most recent being the National Ear and Hearing Disorder Survey. According to 2005 estimates by WHO, 278 million people worldwide had hearing loss, with two-thirds of that figure from developing nations. The first National Health and Mobility Survey in 1986 estimated the prevalence of hearing loss among Malaysians was 2%. In the year 2000, a local study in Tumpat reported a prevalence of 17%. In the annual Research Dialogue 2004, Datuk Dr. Narima Awin, the former director of the Family Health Development Division, Ministry of Health, requested for the research to be taken up by IPH. In a meeting held between the Family Health Development Division, Ministry of Health and IPH, Dr. Jasvinder Kaur was chosen to be the principal investigator for this project. The two co-principal investigators were Mr. Abdullah Razi Muhammad Hadi from the ENT Department of Kuala Lumpur Hospital and Professor Madya Den Suhaimi Siddiq from University Science Malaysia. The research proposal was submitted to MREC for approval in 2004. The budget was received from the Ministry of Health in the form of a grant for approximately 1.2 million ringgit. 33% of the budget was allocated for equipment. The sample size for the survey was 9,490 respondents, based on an expected 1% prevalence of deafness with a 20% non-response rate. The study design was stratified by states and locality, urban or rural. In general, all household members of selected living quarters were respondents. The questionnaire was divided into several sections, based on the WHO Hearing Disorders Survey Protocol, with modifications tailored to meet local settings and requirements. To ensure the validity of the questionnaire, pre-testing was carried out in Gombak and in Sungai Buloh. Two training sessions were carried out for the scouts and data collectors in November 2004 and in March 2005 respectively. Subsequently, a pilot study was carried out to familiarize the data collectors to the research methodology. Data collection started in March 2005 with 10 teams, each consisting of an ENT specialist, a nurse and an audiologist. Data was collected nationwide from the 5 allocated zones. The operation room was set up at a central level, managed by temporary research officers and research assistants. A total of 5 stations were set up, each with their respective functions. The progress of the research was monitored closely by the central research team. 2 post-mortem meetings were organized to analyze the strengths and shortcomings of the survey. The first meeting for the scouts enabled them to give their feedback and experience during the survey. The second meeting was organized for the data collectors. After data collection and data entry, the central team proceeded with data cleaning to ensure validity of the results. This was then followed by data analysis. With the completion of this survey, the Ministry of Health could now develop appropriate policies and programs to address the needs of those with ear disorders in the country.